How clean would you think a surgical tool would be after surgery is performed on a patient? Would you accept the surgeons to just wipe away the grime and move on to the next patient? What if I told you that is exactly what they did, and it was a common practice among the hospitals around, increasing the infection and death rates for the patients in that hospital? Let me introduce you to a man who invented sterilization, thus decreasing the amount of infections and death rates in the hospitals. Richard Barnett's biography of Joseph Lister, published in 2006, states that he graduated in 1851 and went to the Royal Infirmary in Edinburgh, and he realized that there was 10 to 45% of the patients who got surgery would get infections and maybe even die from it. And he went on to study why that was. And he came across Louise Pasteur's germ theory, which states in the microbe notes online that microbes are these tiny, small living things that are too small to see with the naked eye, that you have to look through a microscope to see, can come inside our body and cause disease. That's exactly what would happen when you cut open, and the microbes would enter and fester in there, causing a wound that can lead to infection and maybe even death. And he states that it's not just the visible dirt that you would see on the tools, it's something that's far beyond the concept of germs that's not very common back then. Speakers Robert Siegel and Lindsay Fitzharris broadcast of the butchering art in 2017. Hospitals were very dirty back then. They state that they used to have dirty rags all over the floors, they would have blood on the floors, they would even have blood on the surgeons, and they wouldn't change out. They would even let the spectators to allow them to come in and see for themselves how surgery would be performed, and that was very unsterile. It would be dangerous for the patients and maybe even the spectators who come into the building. And that's where Joanna Bork and How Did Anyone Survive Surgery Before Joseph Lister states of the Telegraph Online, published in 2017, that he thought that they needed to change the system. And with that came a lot of hostility from the doctors, because they thought that he was misinforming the public and thought that his ideas were outrageous, because they thought that it was the bad air and not little tiny microbes that were floating around and causing infection for the patients. And editors Neil Sclater, D, and Josh Lahr's article, Antiseptic and Aseptic Techniques Are Developed, published in 2001, states that he treated the patients with carbolic acid to sterilize the area before the surgeon can perform the surgery. And even Joseph Lister himself, with the book of On the Effects of Antiseptic System of Treatment upon Salubrity of a Single Hospital, published in the 1870s, he would mix it with quicklime and the carbolic acid to dilute the toxin, but it was still an effective way of treating the patient. Even Kelly Grant, the author of Lister Publishes Discovery of Antiseptic and Sterilization in 2018, states that there were antiseptic techniques and aseptic techniques where it would better the environment around them. So antiseptic was the destruction of these microbes around them, and aseptic was the absence of the microbes around them. And I understand how everyone would lead to think that he was the inventor of Listerine. However, that is not the case, but he was definitely someone who was influencing them to think about sterilizing the mouth area before them. So I would like to conclude why this man is the father of sterilization, who bettered our environment in the hospitals to increase our chances in living and going on beyond the days. Thank you.